Hey everyone, it's Denise Brown from the Caregiving Years Training Academy. Welcome to day 3 of Care and Share Our Big Ideas. And just a reminder that we are going to post the archive of all these videos on Monday, October 12th. We're going to send out an evaluation form for you the afternoon of Friday after we complete this event. If you need CEUs, you are required to complete the evaluation form. Once we receive the evaluation form, it's about 5 business days that you'll wait to get your certificate. We want your feedback though, so regardless of whether or not you're receiving CEUs, please let us know what you thought. Okay, Tanya, take it away. You are our first presenter today.
Great, thank you so much. Hi everyone, my name is Tanya Straker. My consultancy is called Family Caregivers Thrive. And my big idea is free basic skills caregiver training for family caregivers, or at the very least, a really good multi-page color brochure. And because this is supposed to be a big idea, standard across the USA, not just here in New York City where I live. So a little bit of context. Great. So because I've worked for 25 years as an adult educator in hospital systems, the standard that the Centers for Medicaid and Medicare hold for employee competency is absolutely seared in my brain. And it looks like this. An employee, a caregiver, a learner needs to be aware of what they need to know in order to do their job. So they're provided with information. Maybe it's a manual, maybe it's a lecturette, maybe it's a webinar, but they're given information. They sign off that they received the information. Maybe they have a little quiz, but then we can check off that they've been oriented. They're aware of what they need to know. If there's a skill that they need to execute, then that skill is demonstrated to them. They demonstrate back that they can execute, and then we can check off that they've been trained. Competency is something that happens over a period of time. The learner is on the job, and in various situations, they're able to demonstrate that they can expertly, continually execute this skill, and they have an opportunity to ask questions, they're supervised, and then over time, if they can meet the standard, we check them off as competent. Now, this is important for several reasons. We often use the word orientation and training interchangeably. We hand people information, and then we check off that they've been trained. And then we're surprised when they're not actually competent to do their job. This is also important, now that you understand a little bit about the world that I come from, that when I had the opportunity to, when I brought my mom, when my mom went from the hospital to the rehab center after a debilitating stroke, and I knew that I only had 6 weeks to learn what it is that I needed to learn so that I could provide nursing care for her once she got home, that there were 2 questions that absolutely consumed me. What is it that I needed to know? And fair or not, who was going to teach me? I really wasn't asking myself, what do I need to learn? I was really wanting to know who's going to help me learn what it is that I need to learn. So I bombarded the staff at the rehab center with loads of questions, and over time I ascertained that it really wasn't their job, and they weren't oriented to be able to understand how I needed to think about things once I brought them home. Once I brought my mom home. However, I did run into what I feel are one of the issues, one of the barriers to there being more basic opportunities for family caregivers to get basic education, is that I was always getting waved off as though, what are you worried about? Medicaid is going to cover the cost of health aides coming in to help you. You don't really need to worry about this. I would get these looks like, what are you so concerned about? People are going to come in, they're going to help you. You'll be okay. In time, I did learn, so what did I learn? How did I learn what I needed to know? Well, I simply bombarded everybody I came into contact with loads of questions, family, friends, paraprofessionals, allied health professionals, providers. I was continually asking questions throughout the time that I was caring for her. And the kinds of things that I wanted to know were very practical. So here are some of the things that I wanted to know, that if you were already in the caregiving world, you said, well, everybody knows what a transfer sheet is, but I didn't know what a transfer sheet is. I just figured out I needed something to help reposition my mother. So you go on YouTube, you research, and you find what you need to find. And my concern here is that some of the basic things that were very helpful, it would have been helpful to have known them before a year had passed. A simple thing like having an oximeter in the house, in addition to a blood pressure monitor. So again, as an informal, as a family caregiver, there were practical things I wanted to know. So because of the world I came from, I was constantly designing in my head, what would the perfect course look like? And so here are some of the elements of as I would think about it all the time. That family caregivers would be informed that there were workshops as they're in preparation for discharge to bring someone home. There would be classes that were live. They'd be offered monthly. They would be free. They'd be grant funded. They'd be skill-based. There'd be an opportunity to be hands-on. They'd be practical. And they would address both physical and cognitive needs of a caree. So that was my dream all through my caregiving time. Now, just to share with you a little bit about the state of family caregiving training, as I've been able to ascertain by constantly Googling, a few things that are interesting to me. For instance, there was a 2011 New York State Planning Survey, and it asked caregivers what they needed most, and training never made it onto the survey. And that's not surprising, because the caregivers that request training are a small subgroup, those who are providing for more complex needs. The majority of classes that are available address Alzheimer's, dementia, and caregiver stress, which is, of course, high on the list of what caregivers are asking for. Another interesting item is that there is a free online home health aid course provided through Coursera. And Coursera, I've taken classes through Coursera. They're excellent. These courses are provided by faculty from some of the best universities in the world. And so there is a free online home health aid course. It is the full 76 hours. It is taught by instructors from the state university system in New York. But that could have been an option for me, something to have done while I was at home, and potentially could have gotten a certification. But the one thing that in all of my constant Googling, I have only been able to find one in-person class that offers the type of care, the type of information that I was looking for. And at least pre-COVID, they were offering in-person class. And that is classes offered by the University of Arkansas medical system. It's their family caregiver class. They offer 2 classes for free. Each one is 4 hours. They offer it in 7 major cities across the state. And the class is available to any group of 10 or more persons that requests it. They'll send the instructors out. And the curricula, exactly what I was looking for. Physical skills, infection control, skincare, incontinence management, nutrition, body mechanics, mobility, caregiver stress, safety, activities of daily living. Now, what's really important here is that this class would have been useful for me, not when I was bringing my mother home bedridden, but 2 or 3 years prior. The very first time she fell, the very first time that I was bringing her home from a rehab facility. It would have helped me anticipate what I was needing to know as I continued to care for her, and she continued to decline physically. So, and the reason why I believe why this course is so practical, why it's exactly what I was looking for, is because it was initiated by a family caregiver. So I kind of created a family caregiver workshop manifesto, what my biggest wish would be, what my greatest wish would be. And basically what this says is that I would love for the curriculum that's already been set by the University of Arkansas, that it simply be replicated, because it's set by standards. It already meets the standards set by the CDC and other other health organizations. And again, as I said, at the very least, if I can't have a full workshop, a really, really, really good brochure that orients family caregivers to everything they need to be thinking about. So with that, that's my big idea, and I invite you to join the conversation.
Okay, thanks, Tanya. Go ahead and stop sharing your screen, and then I'll start sharing my screen. We'll do the transition to another idea. Everybody can see my screen, I hope? Okay, so I started helping family caregivers in 1990, and I worked with them in community-based programs as well as an admissions director in 2 different nursing homes. I started helping my parents in 2004 after my dad's bladder cancer diagnosis. So I saw what happens when healthcare professionals gather to talk about our carees and treatment plans and plans of care and how they're doing. It seemed like there was never a seat at the table for us. We were always outside. So this is a little more dramatic than just outside the room or outside the building, but it's this idea that we're not part of the conversation. And I actually saw that from a professional. When we would talk about quarterly care meetings in the facility, the social worker would always say, "Oh, there's a family coming today." And everybody else would groan along with her. And when I was in situations where I was helping my parents and I was involved in treatment decisions, it always felt like I was fighting to get a seat at the table. So I think we've actually been doing something, maybe not consciously, that takes us to the table, and that is carrying our binders. So if you're a family caregiver, chances are you have a binder of medical information, of your caree's medical history. It's what we bring wherever we go. I knew a family caregiver that actually had so many binders that she used a dolly to bring all her binders whenever her daughter had a doctor's appointment, a hospitalization, or a treatment. The binders are our way of showing we are professionals. We've earned a PhD in our caree's care. Pay attention to us. We know. And if we don't know it off the top of our head, we're going to go to our binder because it's in there. We know. And I also think our relationship with our binders is one of the reasons that we haven't necessarily adopted the use of apps. So there are plenty of apps out there that we could use to actually keep that information, but it's different when you pull up your phone to go through an app versus when you pull out your binder and go through your binder. And I also know that our healthcare system is still paper dependent. We still get lots of papers at discharge, whenever we go to the pharmacy. So we have to keep the paperwork somewhere, so we stay with our binder. But what if it wasn't about what we carried, which is our binder, but it's also about what we wore? And the idea being that we wear a lab coat like other healthcare professionals do. So I had the first iteration of this idea 3 years ago. I was at a conference in Bethesda, and it was a group of researchers presenting the findings of their caregiving research. And let's see, one of my pet peeves is this idea that we don't self-identify as family caregivers. And the reason I have a pet peeve about it is because the onus is on us when the healthcare system is interacting with us all the time. So the researchers were going on and on about how hard it is to reach family caregivers because they don't self-identify, which makes me crazy because it's about the words we use. And if we don't use the right words, we're not going to reach family caregivers. It doesn't matter what they call themselves. Anyway, so as I was sitting in the audience, I thought, well, what if we just wore something that designated us as the family caregiver, like a lab coat? When I got back home, I blogged about the idea. We were in the midst of preparing for our second annual National Caregiving Conference, and one of our sponsors read the blog post, reached out to me and said, what if we do a workshop where everybody who attends the conference gets a lab coat, and then we have ways for them to personalize the lab coat, draw on it, write words on it, make it their own. Well, we didn't have enough funding to do it, but it was always an idea in the back of my head. Then this past November, I attended an advocacy workshop where we had 10 minutes to present our big idea. That was actually the inspiration for this event. And I presented an idea and I attached the lab coat idea to the bigger idea. One of the attendees said to me during a conversation about this idea, my sister had an interesting experience, he said. So his father's in a facility. He and his sister are concerned about the care his father's receiving. His sister goes to the facility after work, starts talking to the staff, sharing concerns, asking for different ways to treat her father. She feels very minimized during that conversation, so much so that she is very upset. So she leaves the facility, goes to her car, gets her lab coat on. She's a physician, walks back into the facility, says to the staff, I'm here to talk about my father. Completely different conversation because she put a lab coat on. So it leads to the question, if we give family caregivers lab coats, when's the right time? So a couple ideas. It might be at time of diagnosis. What if there are two conversations that happen once a family member is diagnosed? What if the doctor has a conversation with the patient about progression of the disease, what happens, what they can expect? And what if a social worker or a certified caregiving consultant has a separate conversation with the family caregiver and says, let's talk about the impact on you. What are your worries? What can I help you with? And then shares resources and strategies and ideas that can help. And then says, here's a lab coat. You might find yourself in a situation in the healthcare system where you feel like your voice is not heard. You might feel minimized. If you do, put your lab coat on. It's up to you how and when you use it, but I want to let you know this is a tool that can help. What if events like a conference are another opportunity for lab coats to be distributed to family caregivers? And what if at the end of one of our training programs, so it's interesting that Tanya was talking about a training program because we actually have a training program that's very similar to that. It's taught by former family caregivers. So they give that perspective of, okay, here's what it's really like in the house when you're trying to provide this level of care. And we call that training program a Certified Family Care Manager program. So what if after family caregivers complete that program and become certified family care managers, they receive a lab coat. The lab coat has their name as well as their designation, which is Certified Family Care Manager. And what if it becomes so prevalent in the healthcare system, us walking around with our lab coat, with our designation, that when there's a meeting involving a decision or an update or plan of care or treatment, oh, I'm sorry, I'm going to go ahead and mute everybody, that the healthcare professionals who are sitting at the table look around and notice an empty seat. And someone says, oh my gosh, we're missing the certified family care manager. Let's make sure we get her on the phone to find out when she'll be able to arrive, because chances are we're doing last minute things to help our caree. We're doing last minute things to settle what else is going in our life. So what if that meeting does not take place until we, in our lab coat, with our designation show up. We are so important to the healthcare system that a conversation cannot go on without us. And I think Bobby's going to talk tomorrow about essential workers. And I think this is part of how we designate ourselves as essential workers. It's what we wear. And in addition, if we have a lab coat, it also means we need PPE. So at time of discharge, when our caree is coming home, we are equipped with PPE because we are healthcare professionals providing care at home. Okay, thanks everybody. So appreciate your listening here. Okay, so here's what we're going to do. The chat room is open. You are welcome to ask questions, put thoughts in the chat room. In addition, if you'd like to unmute yourself with any question, feel free to unmute yourself. Let me know that you've got a question.
Hello, Denise. This is Ital.
Hi, welcome. Thanks for being here.
Oh, thank you. This is the first time I attend one of your presentation. I'm impressed with the idea of the coat, but have you ever proposed that to the Alzheimer's Association, see what they think, if it would be welcome? As a universal thing, as I say, it's really important that it's used everywhere around the world.
I have not taken it to a disease-specific organization. I've only talked about it, for instance, within my hub, my community. So for instance, other family caregivers. And I think it's important to know that this isn't a disease-specific idea. This would be for anyone in any caregiving situation. So any disease-specific organization, for instance, could actually adopt this idea and turn a training program like what we've created. They could do a disease-specific training program, and at the end of that training program, issue a lab coat to anyone who participates.
This is Diana.
Hi, Diana.
Hi. I've been in the healthcare field for over 40 years, and I've always been concerned about patients when they're discharged to home with a caregiver and the training that they would receive before they go home. Because as we all know, everybody wants to go home. People will say anything they can to be able to go home, but then they get home and there's a realization, well, we don't know what we're doing. We can't manage all this. So I think the caregiver training is extremely important, and being on the training end of it, and also I've been on the receiving end of it, it's in the healthcare field, it's very lacking. It's very poor, I guess is what I want to say. They expect that caregivers should know everything, and they give you a quick run through or a talk through. Here's what you're going to do when you get home. And then you get home and you're like frozen. I don't know what to do. So I think caregiver training is extremely, extremely important. And I think we need to put more emphasis on it. So we can get more people home safely.
Yes, yes.
Because in the job I'm in now, I'm doing a lot of case management, and I see the patients going home in 3 days. They're home not even 24 hours and they're right back in the hospital.
Right.
So
yes,
we need to do a better job in the healthcare field of training caregivers so they can care for the patients.
So just to give you an idea of what that's like, my dad had his bladder removed in 2015. So his bladder was removed, a kidney because the cancer had spread, ureter, and he had unrelated prostate cancer. So he actually received a stoma. So he has a little hole that comes out, and that's where the urine comes out. So he was going to be discharged to home. So the ostomy nurse in the hospital gave training to my mother and I. My dad was in a hospital that's on the near west side of the city, which is where his oncologist was. Old hospital, semi-private rooms. The training happened in his semi-private room while his roommate had visitors. Very difficult to hear the ostomy nurse, very intimidating to go through this. If you can imagine what that wound looked like 2 days after surgery, it was, my mom had to sit down. I thought she was just gonna hit the floor. I had my iPad because I thought they're giving me training. I have to figure this out when I get home. I'm gonna film it on my iPad. I asked the ostomy nurse to ask the patient's family to leave while we did this training. We needed quiet. We needed to concentrate. She refused. She said, I cannot do that. So guess what? We get home and the ostomy, that wound has completely changed because it has started healing. So what we learned to do in the hospital worked for that moment in the hospital, but then when we got home, it did not work. We had to figure it out. We were relying on the home health nurse to come in and change it. And then there was a night when we couldn't wait. It was difficult for him to figure out, when does he empty the bag? I mean, there's so much to learn. There's so many variables. We're very emotional. He's not feeling well. So it was late at night and they're like, oh my God, Denise. And I said, okay, let's just change it. So, you just think you're going to kill your caree. There was no way I could kill him, but it just felt like it was a moment where if he survived this, it was going to be a huge victory. Now, my parents are 89 and 86, and my mom provides his ostomy care now. She's 86 years old, and so she's an expert in this. But it took a couple years to figure out, how do we do this? So this idea of training in the hospital is helpful, but that's not what it's like when you go home. And I also think when we look at expenditures within the healthcare system related to readmissions, for instance, why isn't everyone who goes home assigned a visit from a home health nurse? Why isn't that just protocol? If they're concerned about patients being readmitted, then we have to have some support at home. And if we had support at home, it would make it easier. If I knew that there was a home health nurse waiting for us on the front porch when we got home to get us settled, it would make a completely different experience. So I'll just tell you one other thing that we do. So we have a family support team. It's a certified caregiving consultant. It's a specialist who helps order supplies. And then it's a virtual visit from a home health aide. So Diane Glittenberg, who's one of our certified caregiving consultants, is also a home health aide. So we're not going into the house, but we are making virtual visits. So when a family goes home and they're trying to figure out, where does everything go? How do we organize this? What do we do? When do we do it? She can give comforting, soothing, step-by-step guidance. Here's how you give your mom a bath. Here's what you can do to make sure that she is safely out of the bathtub. I think it would just be phenomenal if there was more support at time of discharge in the home, meaning that afternoon when we get home, and then again that next day.
And I agree with you. I worked home health for 20 years. Home health is great, but we have a lot of areas in the United States where home health is extremely limited. And then you also have a lot of physicians that absolutely refuse to sign the documentation for home health, even though they can bill when they sign the documentation.
And
very frustrating.
And I also think that we've had a very different experience with telehealth. Why not just have a telehealth visit from a home health aide who knows the ins and outs, who knows the process, who can be really soothing about a task that is second nature to them, but completely new to us. We are so worried about inflicting damage, so to speak, on our caree that we're going to make it worse, that it's an emotional experience when we're delivering care until we get over the emotions of delivering that care.
I think you're going to see a lot more telehealth since the COVID. That's been another thing, that a lot of patients are refusing home health visits because they don't want anybody in their home because they could bring COVID. So I used to work with telehealth, and it was very nice to be able to talk with the patient and go over their vital signs and all the things that they were doing with the telehealth. So that was very nice, but I think we need to come up with a plan and to, can't remember what I want to say.
That's okay.
To make it so it's all alike.
Yeah,
everybody's doing the same thing.
Yeah, universal.
Yeah.
The other thing
universal.
the other thing about a telehealth visit is that the healthcare professionals see what the home environment looks like. That's part of the training that is missing in the hospital setting. They do not know what our home looks like. And in order for them to provide really helpful, specific guidance, they have to know what it looks like. How far is the bathroom from the bedroom? What does the bathroom look like?
Well, and I saw a lot of things. I saw rats, roaches, holes in the floor, rain coming in through the ceiling where they had plastic where it ran the rain over to the edge of the wall so it would run down. Hoarding, you see everything when you go into the homes. So, and that's what I've tried to tell when I worked home health. I would explain to the hospital nurses, they'll tell you anything to get out. You just don't know what their situation's like at home.
Yes.
That's
right.
why they keep coming back, because they have no support. They have a poor living situation. Many times they're homeless or moving from family member or friend to friend home. So a lot of the people need someone or some help, and a universal, as you're saying, a universal plan and teaching would be very helpful.
Yeah.
So,
Yeah. Thanks, Diana.
So my question, Denise, is since you've been looking at this for so long, what is the barrier? I mean, I looked at, what the national studies or reports have been. And so it's been well recognized that education for family caregivers is critical. And then I tried to follow the money in the 3 states where I lived in. I lived in Georgia, I live in New York now. I work in New Jersey. And so I tried to follow the money. And one of the things I realized is that when the money comes from the federal government to the states, what it looked like was so different in each of the states. And I thought, wow, if I wanted to pilot a program, I could easily do it in Georgia. I haven't got a clue how I would do it in New Jersey because I can't figure out who does what. And New York is just complicated, but I probably would have a better shot in New York. So, but this, what do you see as the barrier to something that is identified, recognized as needed, and yet I would find things like, money had gone to an organization in the name of family caregivers, but the money went to the providers to give a PowerPoint presentation to a family caregiver. And I was like, no, I don't need the provider to give me a PowerPoint. I need my hands-on questions answered. So what do you see as the, what's taking so long? Because it's been long recognized.
I think it's just the disorganization within the system. And you're talking about systems working together. So even if it's a Medicaid waiver program, it's only for persons who qualify for Medicaid. But that also means that maybe they have to connect to a healthcare system. So here in the Chicagoland area, you might be patient, but you might access different healthcare systems for different needs. So for instance, with my dad, we go to a different hospital when he has a problem with his ostomy or cancer. We go to a different hospital if there's some other problem. So he's in 2 different systems that don't talk to each other, but he's not eligible for a program. So if there was a program through Medicare, and a Medicare Advantage program actually took that on, to me, that's where the opportunity is. I think that that would be something that could lead the way. So if a Medicare Advantage program really stepped up and said the way to save is to actually train family caregivers, that could be a difference. So I submitted a grant proposal to better understand what family caregivers, particularly family caregivers of color who live in the Detroit area, want from a training program. And as I was coordinating who would collaborate with us on this program, I went to economic development programs because they were open to the idea that they could do this and that it would be something that could sustain their environment, their community. In the past, I went to caregiving specific organizations and they were not interested.
All right.
Okay, so I went to those organizations, economic development, and then I connected with a program, a case management program that's funded through Medicaid right now that also works with a Medicare Advantage program. And so we're going to use that relationship to see what does a Medicare Advantage program want from a training program like this, and what is the cost? What will they absorb in terms of our cost as instructors? So the instructors are certified caregiving consultants who are former family caregivers. When those trainers deliver, what will a Medicare Advantage program reimburse them for? The training that we've set up is live and virtual, so you can be anywhere and attend the training. But I think if we're going to look at who leads the way, it's the payer. And I think a Medicare Advantage program is the way to start. So I'm curious, what would you, if the healthcare system issued you a lab coat, would you wear it? And you could type in the chat room, you can type yes, no way, you can give a thumbs up. And I also want to mention that if you change how people perceive you, there is a little process that you have to go to. So that's why I say, let's have a conversation with the family caregiver and allow them the moment when they put on the lab coat. Let's not dictate when that moment is. Let's give them the choice that it's a solution that they can use. It goes back to this idea of self-identification. We don't necessarily want to be identified as a family caregiver, which is why when people call us a family caregiver, we don't relate to that. Which is why I think if we have a training program that offers a certification and a designation, that changes our idea of what we do, because we've been trained. Oh, I've been trained to help my mom. So that's why I have this lab coat and designation. I have earned the right to wear the lab coat. So the other part of it too is sometimes we're like, well, you know what, I didn't go to med school, I'm not a nurse. The reality is we have a PhD in our caree, which is why we've earned it. And I think Brian had a comment that I want to go back to actually, Brian, do you mind unmuting yourself? You had shared an idea around training videos that actual like medical equipment device makers can share with us. Tell us a little bit more about that.
Yeah, sure. I was just thinking that it might be interesting if the products that were being prescribed by the hospitals or the home health agencies, often they're the ones that are determining, you know, which brands or which devices, things like that, that are being used by the patients. And if it was almost a requirement, you know, next time you see that sales rep or something, like, look, we're changing our policies, and there needs to be training that we can send people home with, that they can review, they can see what's happening today and in the future, and we'd even like a sample sent home with them. I thought it was interesting. I'm a hands-on learner too. I like to read and review things, but then it sort of solidifies for me once I do it myself. And I know that some of those companies, Ostomy in particular, you know, do provide samples, but, you know, for wound care or things like that, I mean, there's different ways to put on dressings or take off dressings, you know, that are very specific to that unique dressing. And even, you know, even general training, it would be super helpful, but some of the specifics I think would be helpful as well. And someone said kind of like, you know, it's again, kind of tracing back to, you know, the folks who will be impacted by the sale of those products as well. So, you know, like if you're not going to be, you know, getting the sales of the products, you'll be more interested in putting out training videos that are going to be helpful to the to the caregivers.
You know what else would be interesting? I would like to know what other family caregivers think about this product. How do they use it? When do they use it? What works about the product? Which is a better product?
Mm-hmm.
And I don't know off the top of my head if there's anywhere we can go where we can actually rate and talk about the products that we use. Certainly Amazon, for instance, will have, you know, walkers and canes, and we can rate them there. But I should look at where my dad buys his ostomy supplies if there's an ability to rate those supplies, because that's always helpful too. And that ensures that that manufacturer is really creating what we need.
Mm-hmm. Yeah, great ideas. So just thought I'd share that. Thank you.
I'm curious, what was it that you didn't know when you were caring for a family member, specifically, that you wish you would have had someone show you, tell you about, support you around?
I didn't know anything.
Yeah, I guess we don't know anything, right? So we're not even sure what's going to happen next. I think that's the other problem too. Unless we ask the right questions, they're really not going to tell us. So one of the questions I always asked before we left was, what's an emergency? What am I looking for that would require a call to you or a call to 911? What's dangerous? What do I need to be on the lookout for? Oh, transfers and fall prevention. Yeah, we're going to talk about the fall squad. I think that's tomorrow, which is another one of my ideas. But yeah, how do we do the transfers? How do we make sure that someone is safe from bed to commode or from wheelchair to toilet? I also think it would be helpful for us to stay on top of the innovations within the space. So I was lucky enough to connect with a company last fall who hired me to be an influencer, and they have a new rollator, so it's a rolling walker. Now my mom has been using a walker in the apartment for 5 years or so, but the idea that she would take it outside was just the last thing she would do. So when they said, you know, would you be interested in reviewing this? And I said, okay, we'll give you one. They said, we'll give you one. And I said, okay, I'll see if my mom will use it. Well, she uses it all the time. She calls it her scooter. She doesn't use the proper word for it, but that's okay. And it's easy to fold up. It's easy to put in the trunk of the car. So my dad doesn't have to try to, it's easy for him. He's 89 and it has changed her life. It has changed your life. The right piece of equipment can change your life, but how often does a healthcare professional really think about what's the right piece of equipment for our caree? Oftentimes it's, well, you're ready for a cane. Well, how about a wheelchair? But what about conversations around lifestyle and just wishes that maybe a conversation could be really helpful to have? Okay, so we're getting some really interesting comments in the chat room, and I'm so grateful for you guys to be a part of this conversation. It's so helpful. Okay, so Sherry's writing, with my dad, I wish I had known more about his right to refuse transfer to the rehab center. I wish I had known how to demand home care support because that's where he wanted to be. Right, our voice gets lost. There is a process they follow, but sometimes it's not the process that works for us. And a conversation about other options often doesn't happen. Yeah. Okay, so Heather's sharing, my mother has dementia and other medical issues. I would have loved learning tips and tricks and safety about how to bathe her to avoid an hour of her crying. Absolutely, right? I mean, we all have these situations that happened in our homes that we think, how many others are going through this in their house and just, you know, stiff upper lipping it through it, you know, crossing your fingers and, oh my gosh, yeah. So just, so Diana's writing that most of the companies have wound ostomy nurse or specialists on staff that will talk with families and patients on other suggestions or offer questions. So I just want to let you know my experience with that is that we went through 12 nurses before we found the one nurse who shared what we can do to make my dad's experience with his ostomy bag better. Everyone kept saying he has to keep it on for 5 days. My dad's skin is so fragile and so thin that if you look at him, he'll break out into a series of bruises. He could not withstand keeping that bag on for 5 days. We finally found another ostomy nurse at another hospital who said, just change it every 2 days. Changed his life. He was up in the middle of the night because of a leak countless times for years until we found this ostomy nurse. And it wasn't for lack of advocating and asking. It was a lack of the healthcare system saying, this man is in his mid-80s. His experience is going to be much different than someone in their mid-50s. The skin is different. So what they were recommending was appropriate for someone 30 years younger, but they never gave thought, even though he's covered in bruises, that maybe his skin cannot withstand having the bag on for that many days. Okay, so we've got 5 minutes left. Love to hear other experiences that you've had, other ideas that you might have around training. Yeah, so Tanya, talk to us about Amazon, because I agree with you.
I'm just saying that I'm not a fan of Amazon, but the fact is they keep being brought up as they are looking to be a major player in healthcare delivery. They see all the money, the GDP that the United States spends, and they want to be there. And so they're going to be there. So I'm realizing that I don't know what that means, but the fact that I don't care for them doesn't mean that I don't need to be paying attention and not see them as a potential partner, because they're all about efficiency and making money. So if anything is going to drive telehealth, if anything is going to drive how to use consumer data to better support outcomes, they're just going to be a major, they have every intent to be a major player. So when you mentioned them for the other reason, I thought, oh yeah, they're there.
Yeah, I wonder if anybody else knows of any other company that they are watching because they're positioning themselves to be a player in the healthcare space. I think Amazon for sure. And Walmart, I see Walmart doing that as well. Acquisitions and their focus. You know, it's interesting. Years ago, now this probably would be, what year are we in now? 2021? This probably was almost 20 years ago. I actually went to Target, their headquarters, to talk about how do they become more family caregiver friendly. So what's the opportunity for them in terms of merchandising and display, so that if you're a family caregiver, you go to Target to get not only incontinence supplies, but maybe clothes for your caree and other kinds of personal care items. And what was interesting is how Target looks in the store, which is really playing to a younger audience, is what it looks like in their headquarters. So very young, very hip employees who wouldn't necessarily understand caregiving. Now that's a broad generalization. I appreciate that. But when I was there, again, almost 20 years ago, it was clear that this was an idea that they weren't ready to really take on. So we had conversations, we had meetings, but it didn't go anywhere. So I think it's kind of interesting to think about the big box companies, where they're going. You know, what shift are they making to stay relevant? Okay, so SpinLife, I am not familiar with SpinLife, but I will look at it. So SpinLife is an online equipment company that does specials and has cheaper equipment. Okay, so that's good to know too. And Sherry is writing in the chat room, we go to Amazon as a resource for reviews, but going directly to the distributors can help us with price check and define competitors. And I also think if we had what Tanya, you were talking about, which for instance, if there's a group of 10, at least 10 family caregivers taking a training class, they can become almost like their own buying cooperative. What does scale help them to buy at a cheaper price? What can they do to negotiate with even their local home care agencies around pricing? Because they have this organic co-op now. Okay, so we just have just a couple of minutes left, and I want to make sure that if anybody has a thought or experience or an idea that they want to share, everybody gets a chance. So feel free to unmute yourself if you'd like to add one last thought, and please continue to share in the chat room as well. Yeah, and Amazon does meal delivery too. Yes. Yep. So interesting. So interesting to think about what they're providing for us so we don't leave the house. Okay, so it's another situation where we didn't plan, but it turned out that we actually had very much cohesiveness around our big ideas. So as you go out into your work, I will ask you to think about, as a big idea, how you can ensure that the family caregiver is included in all conversations. So if you're a healthcare professional, save a seat for the family caregiver, invite them, and make sure that their voice is heard. And if you're a family caregiver, think about something that you could wear. It doesn't have to be a lab coat, but something that you can wear that reminds you that you have a PhD in your caree, and a seat at the table is something that you have earned, and that it helps your caree when you have that voice as part of the conversation. Tanya, anything else you want to add?
I just want to say that, actually my years in healthcare was as an organization development person. It was really looking at systems. So you're reminding me how absolutely complicated our health system is. I've been so focused as a caregiver, focusing on my mom, but thank you for broadening and helping me to really understand, to think about the context within all of this is happening, and then to just choose, you know, what's the one thing that I can influence and advocate for, and it will make a difference. So I appreciate, you know, all of these conversations that we're having. So thank you.
I just want to add one other thing. Beth had put in the chat room that thinking about maybe a name tag with our name and title. We actually, at one point on an online community that I ran for many years, created a badge that people could print out and then put in a plastic badge holder that you would have gotten at a conference, and you saved and you thought, what am I going to do with this? So we had these badges made, and we made one mistake, which was we had the name of the family caregiver, and we wanted to attach the relationship to the caree. So we included some information about the caree. And one of our members, Larry, who cared for his mom, went to the doctors with his mom, had his badge on, and they refused to allow him to wear it because they felt that it was in violation of HIPAA for his mom. So then we adjusted the badge so that it just had the name of the family caregiver and then the title family caregiver. But he went through the ringer with that doctor's office because he had that badge on. Oh my gosh. Oh, anyway. Okay, thanks everybody so much for being here today. We'll see you tomorrow for another series of 2 ideas. Thanks everybody.
Thank you.